So hi all, in this topic we are going to discuss about pediatric imaging. So the introduction to pediatric imaging, which is nothing but it is essential in healthcare because children under the age below 12 years, they'll develop understanding at different ages, and some successful radiographic studies which depend on largely on the technologist approach. And majorly in the preparation of the examination room. So this abilities varies from every child, from each child, from child to child. It differs according to their development. So the child development is mainly divided into 6 age groups, which is of physiological and psychological developments, which is the first thing is about from birth to 6 months, and infancy, which is nothing but from 6 months to 3 years, and the development is divided into early childhood, which is of 3 to 6 years, and middle childhood, which is being considered from 6 years to 12 years, and early adolescence, which is from 12 to 15 years, and late adolescence, which is from 15 to 18 years. So some anatomical differences will be there, will be present for will get differ from children and from adults. So for example, if young babies, they'll be having thin skull vault, and their vascular markings will not be present before the age of 1 year, and the nasal bone which are not ossified before the 3 years of their age. So paranasal sinuses are not normally pneumatocytes before 6 years of age, and the scaphoid bone is not ossified before 6 years of age. So some anatomical differences also differs from the children which have faster heart rate and respiratory rate than adults, and their red bone marrow is more sensitive, and it is widespread in children, and which is almost in all bones of the present in all bones of the neonate. So these anatomical differences should be taken under consideration while optimizing the pediatric patient for an X-ray or for a CT scan. So how as a radiographer, so there are some way to approach a pediatric patient to get a better diagnostic images. So first of all, we have to introduce ourselves to the child and the parent in a friendly and capable manner. So the child's name, age and address should be verified correctly before starting the examination. So and the next thing is the major one. It is important that we have to speak to the children at their according to their age, and we have to encourage the students. We have to reassure that their attitude has been adopted to us, and we have to give some excessive amount of praise to the students before taking the examination for their every in and on actions, like you are the best child, so just smile. If you are smiling, it will be nice for taking an X-ray, so to take a photograph, so just cooperate. So some kind of praise we have to give to the pediatric patients for taking an X-ray. And there's some common pediatric imaging also is been determined, that chest neonatal, chest post neonatal, skull X-rays will be taken, sinuses will be taken, and dental X-rays will be taken for the pediatric children, and also abdomen X-rays, pelvis X-rays, spine X-rays, which has been taken for if the child is having any scoliosis disorder or not, and leg length assessment will be taken, elbow, ponage, and hand and knees X-rays also will be taken. So the imaging equipment, coming to the next slide, which is which has been described as the imaging equipment. So the imaging equipment, we have to use digital radiographic equipments for capturing fast images for the pediatric children. It has been shown that there has been distinct advantages with the dosages which saves up to 60% when comparing to a speed of computer radiography system in the digital radiography. So however, some post-processing techniques may increase high dose of radiation to the pediatric patients. So we have to optimize, and we have to ensure that the digital equipment are essential before taking a pediatric X-ray. And dose measurement, which has been measured according to the meters in place, and we have to provide a sensitive and simple method of monitoring and for recording doses also in pediatric radiography. The doses will should not be more higher than like the adult for the same like the adult x-rays. So we have to be more accurate while giving radiation exposure to the pediatric patient. So this is the dose measurement chart, and according to this chart the region of interest and the exposure factor will get differs. Coming to the next point, radiation protection, which is the major and a mandatory role in radiography department. So we have to optimize the dose of an X-ray examination according to the principle of the ALARA. So ALARA is nothing but as low as reasonably achievable. So we have to give reasonably achievable radiation dose minimally to the pediatric patient. And next thing is wearing of lead aprons and vest is mandatory, and wearing of thyroid gland is lead thyroid collar is mandatory, wearing of lead gloves is mandatory, safety goggles are mandatory, and some we have to follow some a major 3 basic protective measures in radiation safety, which is nothing but time, distance and shielding. So this is the major thing we have to follow according to the rules and regulations of the ARB. ARB is nothing but Atomic Energy Regulatory Board. So this is how a pediatric patient will undergo an examination by wearing a lead aprons, by wearing a lead thyroid shield, lead goggles, lead gloves. So this is how a pediatric patient will enter into an examination room. Thank you.